This chiropodist clinic in Havana is a rarity in Cuba, which prides itself on its universal, free national health service. The doctor, 80-year-old podiatrist Serafin Barca, is one of the last remaining private, fee-charging doctors on the island. For the equivalent of $1 a consultation, Dr. Barca treats everything from warts and ingrown toenails to diabetic foot ulcers. He works closely with the Cuban Health Service and takes referrals from the state sector.
Y todos los diabéticos aquí los controla el médico, yo por los pies. Muchos años llevan los diabéticos aquí. Un 70, un 80% de los que yo trato aquí son diabéticos.
All of the services Dr. Barca offers are also available for free with the Cuban Health Service, but he has no shortage of patients wanting to see him. Adriana Jimenez is having a verruca treated. Her mother, Anita Jimenez, wasn't happy with the state clinic, so brought her here.
Esta es la mejor opción que he tenido hasta ahora, porque fui al pediátrico y no me mandaron la medicina exacta para eso, y aquí la niña ha mejorado muchísimo. Y gracias a él que lo conocí por internet, y bueno, nada, la niña está mucho mejor.
Eladio Blanco is a diabetic and has been a regular patient of Dr. Barca's for many years.
Siempre tiene muy buena atención, es un hombre muy humano y tenemos una relación muy familiar y de cliente también. Me gusta venir aquí.
Dr. Barca's work is perfectly legal.
Following his incredible victory over Batista.
In the early years of the revolution, when Cuba was in the process of creating its national health service, Fidel Castro agreed to allow doctors who'd graduated before 1963 to continue with private patients. It was a bid to stop them leaving the country. There were 6,500 doctors in Cuba in 1959, the majority of them in Havana. But after Fidel Castro started taking over all the private clinics and hospitals on the island, more than half the existing doctors left for the United States. 84-year-old Dr. Gregorio Delgado is the official historian of Cuba's Ministry of Health.
Se nacionalizaron muchas empresas, todas las empresas mutualistas, las empresas privadas, y todo se hizo servicios gratuitos de salud pública. Y una gran parte de esos médicos que eran dueños de casas de salud y todo eso, se fueron de Cuba. Se van de Cuba. Y entonces la revolución, de 6.500 médicos, se queda con 3.000 y pico de médicos.
Two of Fidel Castro's priorities after the revolution were health and education. In 1961, he launched the world's most ambitious literacy campaign. Thousands of students were sent to the remotest parts of the countryside to spend a year teaching everyone to read and write. There was a similar, though more modest, medical campaign where graduating doctors were sent to the countryside for 2 years. Gregorio Delgado volunteered to go to the Sierra Maestra Mountains, Fidel Castro's base during his guerrilla campaign.
Aquello fue extraordinario. Yo no me puedo quejar. Para mí, para ellos, yo era un santo que había llegado allí a curarlos y a curarlos gratuitos, porque además no cobrábamos. Eso fue muy importante para ellos, que los trataran, que los curaran y no les cobraran.
Back in 1959, there was just one medical school on the island. Today there's one in each of the 15 provinces, plus an extra one in Havana to train foreign doctors, many on scholarships from the developing world. And from the 6,500 doctors before the revolution, there are now around 74,000 doctors in Cuba providing free health care throughout the island. So many, in fact, that exporting doctors has become a major industry here. Tens of thousands of Cuban medical staff, like this team in Haiti, are working abroad, often in remote and dangerous conditions.
This is you, eso es usted.
But back when Serafin Barca was studying medicine, thousands of doctors were leaving the country for the United States, and in a bid to stem the flow, Fidel Castro agreed that those who stayed could continue to have private patients.
Yo me quedé, tenía la consulta, estaba en una posición bien, estoy en una posición bien y no tenía necesidad de trasladarme para otro país. Me dio la idea esa de...
Dr. Barker says he has no intention of retiring and will continue to treat private patients as long as his health holds out.
No me puedo jubilar porque me muero. Yo estoy trabajando desde que tengo 12 años en distintos... he pasado hasta que ya al final fue Siempre me gustó la medicina.
When Serafine Barker finally does stop working, this could mark the end of private medicine in Cuba.